In this presentation, we will be discussing pharmacodynamics. When qualifying as nurses, this is something we need to be aware of, especially when administering medication. Pharmacodynamics is defined as the branch of pharmacology concerned with the effects of drugs and the mechanism of their action. Now let's look at this on a cellular level. Receptors are located primarily on the cell membrane but can be found within. Medicines bind to these receptors, forming a drug-receptor complex. This in turn changes intracellular processes depending on the medicine. Each receptor has an intricate 3D design which will only allow a certain type of medication to bind to it. This can be compared to a lock and key analogy. Most medicines can be placed into two categories, agonists and antagonists. Agonists work by binding to the receptor to either activate or deactivate it. The drug with the highest affinity will bind and produce the intended response. Antagonists work in the opposite way by binding to the receptor in order to prevent another drug or body chemical from binding. This, in most cases, will then stop the unwanted response from occurring. There is also a third group called partial agonists. These work by binding to the same receptor that the agonists bind to. The difference is, it only produces a partial response. It is for this reason they are sometimes known as competitive agonists. Due to the intricate structure of the receptors, they will be able to recognize specific chemicals or drugs that can bind to them. This results in a strong drug-receptor complex. The weaker the affinity, the larger the concentration of drug needed to produce the desired effect. Now let's look at some examples. An example of an agonist is morphine. This works by binding to opioid receptors present in the nervous system. This results in the desired response, in this case, pain relief. An example of an antagonist is naloxone. This works by binding to opioid receptors with a greater affinity to prevent an unwanted response. Therefore, it is generally used for opioid overdose, as well as Class A drugs such as heroin. Being more aware of pharmacology as nursing students allows us to be more informed on registration. When administering medication to patients, it will be important to know what the drug is and how it works in order to be aware of possible side effects. It is also a great way to reduce drug errors in practice.
Created using Powtoon.